morning. How are you all? It's 7 p.m. and I'm here with you on PsychoTalks with Neha Mehta. Today we have two esteemed experts of our panel with us, Dr. Sritapa Roychowdhury, all the way from Kolkata, and Ms. Surabhi Setiya, clinical psychologist, Pune, Maharashtra. So these both will be taking all your queries today and help you to guide what is the difference between an advice and the counseling. What is the difference between going to a psychiatrist or psychologist? What are the common myths and misconceptions related to seeking help from a psychologist? What to expect when you go to a counselor? So some of these basic queries which we all go through and comes into our mind when we feel like taking help from a professional. So these experts will help you to clear your doubts today. So I want both of you to introduce yourself to our audience, first with Sritapa and then Surabhi.
Hi, Dr. Neha. Uh, Firstly, I would like to thank you for inviting me here on your show. And hi, everybody. Good evening. This is Dr. Sritapa Roychowdhury. I am based out of Kolkata, as she said, and I have completed my master's in applied psychology. And then I have done a 1-year postgraduate diploma in counseling psychology from University of Calcutta. And since then, from around 2011, I'm working in this field of psychology. And I would count myself privileged enough that within this brief period of time, I got to work with different organizations, and therefore I come across to see the clients coming from different socioeconomic backgrounds, as well as different age groups also. So that's it. And
Perfect.
what about
So Surabhi, I want you to introduce yourself.
Hi everyone, my name is Surabhi Setiya and I'm a clinical psychologist. So I have completed my MSc in Clinical Neurodevelopmental Sciences from King's College London, UK, and I have worked in not just national but international institutes such as Moseley Hospital, UK, then Dinanath Mangeshkar Hospital, Pune, Akanksha Foundation, it's an NGO, and many more esteemed places. And my personal experience with counseling started when I was a teenager. As a teenager, I had a need to go to a counselor to speak to a person who will understand me completely. But during that time, I couldn't find someone who could lead me, who could guide me. So when I got into the field of arts, I came to know about psychology and how it works, and that is where my journey with psychology began. And today, I'm proud member of a mental health association. Thank you.
Okay, so the question I would like to ask you, since we have planned for this interview, is what kind of clients you basically see, and because during my in my practice, I used to see lots of clients coming with lots of questions inside. Even after taking a complete counseling session, they were like, "क्या हुआ?" मतलब मुझे कुछ समझ ही नहीं आया. हमने बात क्या की, हुआ क्या, बेनिफिट क्या हुआ. तो वो बहुत सारे क्वेश्चन जब हमें ऑलमोस्ट हर क्लाइंट को समझाना पड़ता है कि सी दिस इज अ प्रोसेस, this is a journey, it is not a one day quick fix that you will talk and you will get back to your solution. So what are the myths associated? There are many who come with a question that I don't think कि दवाई जितना असर करती है उतना ये असर कर रहा है. मतलब there are certain like
Right.
dilemmas in their mind. So what common type of myths you guys encounter while you practice? And in between, I'll take all the queries. All the forum members are requested to keep posting your questions and they'll answer it.
Right.
you go first? Surabhi?
Okay. So,
Okay.
for me, the most common is that there are three things that I follow before start of any of my sessions. The first one is that I explain exactly what counseling is. So the biggest myth of counseling that I have faced, that people think that it's a talk therapy, that we are just going to talk and your problems are going to go away. So I'm really sorry to say this, but it's that is not how it works. So basically, we listen to your problems, and from that, we actually understand how to guide you, how to support you in your journey towards healing, towards a better life. So we use different therapies and even healing techniques to help you. So is the first myth I have come across, and I think, ma'am, you can go for the second myth.
Okay, then the first thing I would say that whenever I see a patient or client, especially with the adolescents one, their parents come up with the expectation that probably they want something and they want to convey their messages through us, and they expect that we will convince their children and guide them according to their wish to choose, suppose, a profession or a career like this. But a counselor is not a guide. There is a very fine difference between a guide and a counselor. In a counseling process, we just uh, play the role of a catalyst, I would say, because don't uh, we don't force anybody to choose any kind of opinion of our own. We are not there to guide them according to our philosophy, based on our value system and all. Because if we do so, then there is a high chance that the person who is following or who is listening to me, that person has his or her own opinion also. He or she can reject that thing also. So in our counseling process, there we try to make them understand or make them educate that the thing is that we just follow a structured scientific procedure. Like, firstly, we establish a rapport, a professional relationship, I should say, because here we have to very conscious that in our terminology we said this as transference, because our emotion and their emotion, we handle it with a very a very delicate way, because our emotion cannot violate this process. Our emotion have to be regulated, our counter transference, and their emotions also should be channelized in a proper way. So firstly we will establish a professional rapport with them, and then both of us will have to identify the problem. Both of us, we are as a counselor not there to diagnose any problem. A diagnosis is not our thing. If the problem is very severe, then we have to understand that being a counselor, and we have to straightly just refer to the cases to a clinical psychologist who is capable of doing a diagnosis, or if she or he is needed, she would be referred to a psychiatrist as well. Then after identification of the problem, we will assess the problem and then go to the further deeper, we will set the goal together. The process is that we will do the thing mutually. This is not the thing that we as a counselor will do everything. Yes, the steering will be on our hand, like here in this talk show, the steering is on the hand of Dr. Neha. She knows it very well when she wants us to talk, or when she will drive the whole show. Like this, in our counseling session we will drive the show, but at the very same time it is a mutual process. We have to remember that. So it is not the thing that you will come and the next day you will there will happen any kind of magic and you will get your solution. We are here to make you enough capable so that you can take your own decisions by your own. So we are playing the role of a catalyst. not we are forcing you to take our decision. That's
Can
it,
I
I
add
think.
to this?
Yeah, sure.
Yeah. So, one more thing, like as you were saying, I remembered like a lot of people have come up to me and asked me, like as a psychologist, that can you read our minds? So the
Yes,
first
that is the most.
misconception starts is like
Yeah,
I can read your mind, but I think the entire idea or ideology behind is that as a counselor or as a psychologist, we have been trained to read your body language, like how you
yeah,
sit, how you
exactly.
talk,
Gesture.
and
Yeah,
those verbal and
body
non-verbal
languages.
clues, we are able to understand what you are trying to say to us. So the main
Yes,
role as a counselor or as a psychologist is to understand to the needs of the client without even they addressing it. So that is
yes,
where you
definitely.
know that the counselor or the psychologist is perfect match for you if they can understand your verbal as well as your non-verbal
And
cues.
non-verbal. Yes, absolutely. Very good point you have just.
Thank
Uh,
you.
yeah, that is a very important point. So sometimes they come up and just pour their mind in front of us, and they just share their everything with us. And some other time they will never going to talk and open up
And it's
for a long
completely
time.
fine.
Yeah, that is completely fine. And this
Exactly.
is the we get that kind of training, that in our training we are just taught that we will always accept the client as he or she is, and make him accept his emotionality and
Right.
everything,
So it's
because
also
that is
good to
very.
remember that I think as you gave the example, like all five fingers are not same. So that
Yes.
way, like each and every person will have a different need, will have a different way of expressing their need. So as
Yeah.
a counselor or as a therapist, we have been trained, and not just before we sit on the place of a therapist or a counselor, we have been first made to sit in the chair of a client in our training to help us understand that how it
Yes.
actually works. Like as a
How
client,
it
how
works.
am I going to feel when I come to a complete stranger? How are they going to help us out? And I think, ma'am, can you explain more on how we make a person feel more comfortable on that level?
Yes, that is the first thing. I suppose that is the basic thing of any kind of counseling process. You have to firstly make the client comfortable and feel that you are safe enough, and your secrets will be safe enough in front of your counselor, and the secret will not be disclosed to any other
Exactly.
person, because that
Unless and
is.
until.
Yeah, unless and until it is very important for his treatment or therapy. But before apart from that, basically we are not gonna share their secrets with others, and that is the most important thing. We every time we just hesitate to open up because of this only. And the other thing is that we always think that the other person sitting in front of us going to judge us, will going to judge us
Right.
based on some problem, I should say. Because
Right.
if I'm very angry, then it is a problem. If I am very depressed, then the society will call me as a mad person or lunatic
Right.
person. So
And very good point. Like, even some people think that just because you're going to a counselor, you're weak.
yeah, exactly. You're weak. You cannot handle your problem very well. But in counseling process, we just strategically make them learn that they, and motivate them also, that they can solve their own problem.
Right.
And through the sessions they become much more capable, and after sessions they become the better version of their own selves only. So this is the
Yeah.
thing, you have to understand that counseling is very much important for any person or every person. If your problem is very deep rooted, or maybe a very casual problem also, you can anytime go to a counselor if you feel like. and you can see your doctor or your psychiatrist or your
Ca-
clinical
Can I add to
psychologist.
this?
Yeah, definitely.
So, when it came to the point of confidentiality, as you have mentioned it, that whatever has been said between the counselor or the therapist doesn't leave the room. But we have to also remember it will leave the room on just these three major rules. So, the first one is, if we think that you are going to cause harm to yourself or to someone else,
Yes,
then
yes,
appropriate authorities will be informed about your situation. Second,
definitely.
if the court demands us that as per some trial is going on, let it be a
For
marital dispute, or let it be
delinquent
you have been
crimes. Yeah.
seen for some other reason to the court, you have been brought about to court, then we have to share the information of each and every session with the court. And the third one is, if you give us a consent. So the consent part is very important. Unless until you don't
Yes,
give us a consent, it won't
it
leave the
cannot.
room. And
Yes,
even if
yes.
it
The
leaves
third
the
one is
room,
the most important one.
exactly. And even if it leaves the room, you will be informed, like you will be there in front of us when we are sharing the information because
So
you
there
have given us
also
the
we are not
consent.
breaking their belief. There also we are
Exactly.
just not breaking their belief. We are keeping their secrets until and unless it is very important, and until and unless he or she is agreed to share it with others. So the first thing they will be comforted, like you are very safe here and your secrets will be kept. And the third thing is, it's okay to
Exactly.
angry, it's okay to be sad, it's okay to be
And
depressed, it's okay
and
to be angry.
more than anything, accepting it that
Yes,
this is a safe space for you to open up, because even if you're going to be angry in front of us, we are going to join you in removing it out, in letting it go in a more healthier manner, because we have
yes,
different
that's the
therapies,
thing.
for example like CBT, cognitive behavior therapy, or
Yes,
REBT, rational emotional behavior therapy, or even expressive art therapy, which will help us to express it in more healthier manner. So I think that is
yes,
also one of the
you will
most
be
important
trained
part.
in a cognitive behavioral therapy to restructure your thought process, how you deal your cognition and as well as your behavior. We will uh, gonna give you some sessions. Through this, you will make your own strategies. You will do the mental exercises through which you will get expertise, and you will be skilled and
Exactly.
to deal with your problems. And in future, whenever you will face this kinds of a problem or other kinds of a problem, you will deal it by
Exactly.
your
And
own
there's
self.
also one thing that I've
That's
always
the
come
power.
across, that clients always ask me on the end of very first session that session has gone amazingly well. They know what they are supposed to do. They know the role, what role I'm going to play in their life. But they always ask me this one question: और कितना टाइम लगने वाला है, मुझे और कितने
Exactly.
सेशंस आने पड़ने वाले. So this is
This
one
is
thing I
the basic
always,
thing.
yeah, so this is one thing I always tell my clients, like this is my go to motto, is that if you come for one session, it's going to help you for 2 weeks. If you are going to come for 4 sessions, it's going to help you for 6 months. But if you come for 12 sessions, it's going to help you for lifetime. So it
Forever.
is your choice
And
to
that is
decide that.
also based upon your problem. You are a
Exactly.
different individual. You can be your situation. You can start learning dealing your problem within 12 sessions also, or
Exactly.
else you may needed 22 sessions also. It completely depends upon your problem, individual problem. So there is no
As
thumb rule. There is no thumb rule that you will gonna be cured or you will gonna start to manage your problem within this time period,
and
this
it's
fixed
also
time.
important to know if you're
It's
going to
your,
a
if you feel
psychologist
like,
or a
yeah,
counselor also, because
yeah,
even the skills what a counselor has and the skill what a psychologist has is going to differ, and even between two counselors or two psychologists, the
Definitely,
skills are going to differ. So
definitely,
it's
definitely.
completely depends on your relationship. And
Yes,
as
you may gel with one person or you may not gel with the other person. And the other thing is that, according to the educational background, you have to keep in mind that being a counselor, uh, we have different specialization. So we work for a specific purpose. Say, my region is mental health. Some other counselor is working with the sports person. She is the sports counselor. We have already seen her interview, Dr. I
right,
think Rujuta.
yeah,
And then there are plenty in number of fields of counseling, like career counselor, adolescent health counselor. There are so many specialization area, and whenever you are going to a clinical psychologist, they are specifically dealing with the clinical cases, like those who definitely need therapy. And if he or she is needed, apart from therapy,
and
he is need medicine, then she is always been referred by the clinical psychologist also to a psychiatrist. And
and the
the
most important thing I think it's here to understand is that we all work together. If
yeah,
you want a
that's the point.
effective
Yes,
therapy as a
yes, that's
counselor
the
or a
point of,
psychologist, we
yeah,
all work together. And my
work
fit
together as
brain
a
is,
team, as a team.
yeah,
Yes,
and my fit brain provides us that beautiful place,
platform.
that a platform that we can all work together. So I think that is
Yes,
very
yes.
beautiful.
That is amazing, because it is very important to understand that we work, our specialization area is different and we work as a team. And if we there is a space for referring our clients, then we are doing just that thing only for to help the clients. So
Exactly.
we are working as a team, that then the outcome will be best. So the platform, I would appreciate the effort of Dr. Neha in this regard, that my fit brain is the ideal platform, I think, where we all work
Exactly.
as a team.
Work together, yeah, completely.
Yeah,
Thank you both of you for giving your time to our audience. So let us know how we
also.
can book you if anyone wishes to book both of you, because one of we got one of the query over here that somebody wished to Dr. Surbi, and how we can connect you. So let us know your specialization on MyFitBrain.
So I am specializing in adult counseling. So I deal mainly with relationships and even with day-to-day life routine issues that you are facing. And you can book me through my FitBrain platform. So they will for sure give you my availability and how you can connect with me.
So I think MyFitBrain is a user-friendly portal where you always can find your therapist. If you have any kind of preference over your therapist, you just have to write down his or her name here. Like, if you want me to counsel and fix an appointment, you just have to write my name. That is Dr. Sritapa Roychowdhury, and you will get the appointment according to my availability. Or if you want uh, any therapist according to your budget and your availability, that is also possible. So there is, you are getting both way chances to select your therapist. So I think that way my FitBrain is a ideal portal to be connected with any therapist, and we are here for you to help you anytime.
Thank you so much, both of you, for giving your time. You guys are just amazing and clear lots of doubts the client might have. So, in order that the next time when we have a client who has the questions related to counseling and everything, so this is the link I'm going to give them. They go through this session and you will able to clear all your doubts. Thank you so much, both
And
of you, for giving
Thank
time. It was
you.
just an amazing and worthy session.
Okay,
Thank you
thank
so
you. Thanks
much.
a
Have a
lot.
great time,
Thanks a lot.
everyone. Bye.
Bye.
आपने जुड़े रहना है मेरे साथ। कल फिर 7 बजे मैं आपके साथ एक और थेरेपिस्ट को लेकर आपके साथ आऊंगी और हम बहुत सारी क्वेरीज, बहुत सारे क्वेश्चंस को पूछेंगे। सेम प्लेस, सेम टाइम एंड अ न्यू थेरेपिस्ट। थैंक यू सो मच। स्टे कनेक्टेड टू साइकोटॉक्स विद नेहा
Thank you.
मेहता।
Bye.
Bye.